Lovely. Good morning, everyone, and a warm welcome to this session on youth led initiatives in using technologies to drive access to better TB services and treatment. I am really thankful to the few of you who've showed up for this early morning session and really hope you can take away some interesting insights back after the session. Today's conversation really brings together two powerful forces that are driving the TB response: youth leadership and digital innovation. We're at a pivotal moment in TB response. As countries are rolling out newer treatments, newer diagnostics, it's clearer than ever that scientific innovation alone is not enough to end this public health crisis. These breakthroughs need to be matched with community-led approaches that are building awareness, strengthening demand, and ensuring accountability. Across high-burden settings, we've all seen how youth and young leaders, especially those with lived experiences, have demonstrated and shown themselves as credible partners of TB care. Their digital fluency and innate ability to connect and mobilize their peers in this fight against TB and addressing some real challenges such as stigma, raising awareness, and addressing those misinformation and misconceptions related to TB is unparalleled. So in this session, what we aim to do today is hear practical insights and some experiences from our esteemed panelists on how youth-led approaches really can be clubbed with digital innovations to really strengthen the TB response and care cascade. But before I dive into the presentations, I'll briefly request my chair to kindly introduce herself.
Good morning, everyone, or as we say in Portuguese, bom dia. It's very good to see you. Thank you for your engagement, for attending the session. Thank you, speakers, for being here as well. Thank you, Akshaya, for the invite to co-chair. I am Chiemi Arakawa. Despite my Japanese name, I'm from Brazil. I'm Brazilian. I work for the National TB Program in Brazil, and it's a pleasure to be here.
Thank you, DME, and I realize I didn't introduce myself. So good morning, everyone. My name is Akshaya, and I lead the Fast Track to the Cure campaign. This is a campaign that was created with the support of TB Alliance and is being done closely in collaboration with the Stop TB Partnership as well. And the objective of this campaign is really to fast-track newer treatments and strengthen and bolster the TB and DRTB care cascade. So our first speaker for today is someone that you've already seen in action 5 minutes back. It's my pleasure to invite Aman to make his presentation. As most of you may be aware already, Aman is a dynamic youth leader and founder of Unite Global, a youth-led initiative championing meaningful movement in TB elimination. Aman has over 5 years of experience in public health, particularly among LGBTQIA+ and key population. Welcome, Aman, and we're looking forward to hear you.
Thank you so much. Am I audible? Yes? Okay. Because we have very less people in the room, but our voices are very strong. And so I just wanted to make sure that we all are here, not somewhere else. And yes. So, my name is Aman Shukla, and I am based in Delhi, India. I lead a youth-led network called as Unite Global. It's a global youth platform for young people to advocate for their rights, do awareness, advocacy on TB response, bringing youth leadership in the TB response, which was missing. And we know that TB is not yesterday's disease. It's a 100-year-old disease. And here you can see some of the pictures of young people's action in the ground. You will see some of the interventions, advocacy awareness among adolescents in school, young peoples in skilling centers, orphanage children living with HIV in Manipur, hard-to-reach area. And these are some of the work that we do at the grassroots level. Of course, everything is entirely voluntary, but this is all driven out of our passion and dedication to NTB. My subject for this presentation is youth-led innovation and success stories on drug-resistant TB treatment rollout. So whenever we do the awareness sessions and any work related to the TB, we make sure that we include drug-resistant TB information for the young people and adolescents to understand, so that they have a good treatment literacy about the drug-resistant TB like BPAL, stuff. So I don't have any conflict of interest at this moment, but maybe would like to have more conflict in the future. So, for the global context, we all know that WHO published a global TB report, and it gives a very good kind of a vibe and very bad kind of a vibe. Why? Because they say that it's a progress in TB response. I don't think so. It's a progress in the TB response because still we see that there are 10.7 million people fell ill with TB, and it was the same scenario in 2023. There are people dying of TB, 1.23 in 2024, and in 2023 we all know it was 1.3, and I don't think so that is a progress. And we still need a lot of work to be done, and for that we need each and every stakeholder on the table to work for this. So youth innovation from awareness to action. Unite has been doing some of the work in India. We have a country chapter in India and a dedicated team of people who voluntarily work in different states of part in India, where the burden of TB and DRTB is very high. Unite engages youth to strengthen TB awareness and literacy, especially on new regimen like BPALM, because having a good treatment literacy will improve your outcome of the better outcome of the treatment, and also when you're facing with any other side effects, you will be able to kind of cope up with that. And that is the reason we need to have a good treatment literacy. We know that we will be able to cope up. We will be able to also educate our other fellow members about the treatment. Collaboration with the universities, Indian medical associations, NSS means in India we have a wing of National Social Service, or we say National Social Scheme, where there is a young people's network that talks about and work on social work, and that is how we thought of engaging them and educating them about TB. And youth institution across India, we promote treatment literacy, we promote peer advocacy and informed health decision. It's just not important that people those who are converted should know about TB. It is important to educate and promote about TB's work people those who are not affected by TB, because I understand that TB anywhere is TB everywhere. And we think that if this kind of activity promotes the ripple effect and youth taking a leadership role and spreading awareness in their communities brings an impact, and that impact brings not only in India but globally. As we all know that in India we have 25% of global TB burden, and if we do something in India and it gives an impact globally. Till now, we have engaged 2,500 plus students actively through our campus event webinar when we started this work in 2024 till date. So this is a number that a very small number as per our country's burden and population, but we are trying to do much more things with the TB Alliance, Fast Track the Cure, and many like you all, to bring impact among young people. What are those digital innovation and social media work that we have done as a youth TB movement? We do a digital storytelling on Instagram. We do it. We talk about myth and facts on our Instagram through podcast, through Instagram lives, and we also bring people those who have finished their BPAL-M regimen and talk about their experiences. And we also bring people those who have not got the chance to have the BPAL-M. And talk it gives a good information about them, what was the situation earlier and what is the situation now for the people who don't know about the TB history. And then we do the webinar connecting experts and young TB survivors and DRTB survivors to discuss new treatment updates. What are the difficulties that they face, and they don't want to be seen that same thing with their other fellow people. So we discussed that as well. And this is a result where we saw that 20,000 plus social media engagement on youth-led TB contents. In just 2025, we saw that on Instagram, Facebook, and on our LinkedIn. Youth followers from 15 plus Indian states fostering inclusive TB dialogues online. Now we have India is a vast country, diverse language, diverse culture, diverse people, and they have diverse kind of way of acting. We have coped up with that mechanism and thought of having a state ambassadors, and now we have 11 ambassadors across India to act on this voluntarily and support this cause to end TB. Innovation in health literacy, what else we did? We developed a brochure called as Nourish to Flourish. It's a community-led brochure that talks about the information about nutrition in TB response. In collaboration with Stop TB Partnership and TB People Global, we developed this brochure to promote balanced diet guidance, mental health care, and treatment adherence tips for young people who are undergoing DRTB treatment and other TB treatments. And we have Temi here, who has also the part of this development of the Nourish to Flourish document, and she was the part who also shared the best examples from the Brazil. And we emphasize that, WHO also emphasized that undernutrition is one of the strongest TB risk factor globally, and we all know that, but still we lack on working on that. And that is how we as young people thought of having a brochure and disseminating that at the country and grassroots level about the importance of TB, nutrition into the TB response, and advocating for having nutrition integrated TB response in all the country. And that is how we developed this and circulated among youth-led CPOs and then global networks to adapt this document and take it forward. Youth engagement in achieving end TB goal. We know that global target as per UNHLM 2023, we want to see that 100% coverage of rapid TB diagnostic testing and 90% treatment coverage by 2027. But the gap of the funding is still persist, everywhere, and we are not able to cope up with that. That is the reason we all need something which is voluntarily and needs less resources to amplify and do something about TB. Promoting treatment literacy and on BPAL-M rollout, creating digital accountability through youth-led monitoring, mobilizing youth voices for domestic health financing, and political and financial commitment at the country level. So these are some of the work that we have done as a young people, as an innovation in the country. So thank you with this. I'm at the end of my presentation, but I just want to finish this with one sentence, Akshay, I'm so sorry. Every young person leading change against TB is rewriting a story. From stigma to strength, from patient to leaders. So please invest in young people. Thank you so much.
Thank you so much, Aman. And just to summarize what Aman said, I think he very, very pertinently flagged the importance of also using digital advocacy as a tool to create mass awareness, especially with the rising challenges and funding constraints. We need to look at which are those, simple sort of tools available to the young leaders which can be used for reaching out to more number of people than the traditional approaches, which were more cost, resource, and resource intensive. So lots of interesting takeaways from your presentation, Aman. I'll request TME to introduce our next speaker, please.
Okay, so we are going to move now to our next speaker, and I'm pleased to welcome and introduce you to Dr. Kins. Dr. Kins serves as the CEO at Topazi Foundation, a leading nonprofit organization in Pakistan dedicated to combating TB. And her leadership has fostered impactful partnerships and integrated digital health solutions to improve healthcare delivery in underserved communities. So please, Dr. Kins, it's a pleasure to hear your presentation, please. Thank you.
Hi, thank you so very much. Thank you for the kind introduction and inviting me to the session. I'll be speaking about using community-led monitoring tools that raise awareness, generate demand, and promote community-led monitoring, and how we have used this to improve access to the shorter treatment regimens that now we have access to. I have no conflict of interest to declare. When we can map every single road, every single restaurant, every single route, why can't we map an individual's pathway to care? That is where we started. Because the first, we were sitting in an NTP meeting, and I've tried to find a TB-related facility because this was during the JPRM almost like 5 years ago. We were supposed to go to a facility. I searched it. We couldn't find. Then I just found, searched BMU. You don't find anything. Then I searched Gene Expert. You don't find anything. So that was the point I realized, like there, on our Google Maps, on Apple Maps, there is no way, at least in my country, where you can find that, okay, if I'm having symptoms suggestive of TB, how do I get to the facility? There was nothing. Then and that is one of the reasons why we lose people along the cascade. It starts with the symptoms, like every person affected by TB's journey, but then there comes stigma and there comes taboo. Oh, the moment you start coughing blood, you are jinxed and you would be discriminated. Oh, you will face so-and-so problems. And then comes the excess, whether the person will be able to find the facility nearby, if the person is living on an island or if a person is living in a village, whether they'll be able to find the facility. When they go to the facility, will they be accepted to the facility, or whether what we have seen in some of the cases before the computer monitoring was offered, that the person's peer supporter was invited inside the doctor's room and the patient was supposed to sit because the doctor was too worried that he or she might, sorry, I'm slightly gender-biased, he or she might contact TB from that person. We started piloting OneImpact, a platform that gives you information about the disease. There is a get information module. There is a get access module from which you can access all the facilities, all the gene expert sites across the country, alongside the details mentioned, whether you can get diagnosis there, whether you can get your treatment there, or it's a peer group or something like that. So all the sites we did the launch in one pilot district and scaled it nationwide. This was thanks to the support from Stop T Partnerships Challenge Facility for Soul Society, which is currently quite under the bar when it comes to funding. And we invested in champions and leaders affected by TB who can, if a person goes to the facility and gets a problem, they can actually report that as a barrier for the first time on an app. And then that is connected to dashboards, and that is connected to up to the level of NTP. We validate the barrier. If the barrier can be addressed at district level, it gets to district. If it can be on the regional level, and so on and so forth. If not, it goes to national level. This is the first ever platform through which the barriers faced by people affected by TB can actually be reported and addressed in real time. And we use the data to guide the future programming. So over 95 community sessions were done, mass awareness campaigns were done. We have a registration of over, I assume, 30,000 at the moment. The next phase come when, thanks to Fast Track to Cure, we got a chance to build the drug-resistant TB pathway in the same platform. And TB Alliance was kind enough that they didn't ask, oh, no, today we want a new platform. They said, okay, you have a platform, let's build on that. So thanks to the support from partners, TB Alliance technical support, we were able to build a DRTB module into the same. And that included building knowledge around DRTB, because we did a country rollout of BPAL. However, when you go to a doctor is too careful about me prescribing BPAL might give my guy some kind of system or some kind of adverse effect, or the person might lose their life and that will come on me. So I don't want to prescribe that. I still want to keep on prescribing the longer treatment regimens. Even for the shorter treatment regimens, it was a sort of quite a big game that we went into before the shorter treatment regimens one. For BPAL, people, doctors were that. And then even in the community perspective, oh, my grandfather got cured because he got 26 tablets and 36 injections, so maybe I also need to get through that to go. Here we started downstream up, so when a person with TB can actually demand that they want the shorter treatment regimens, will actually know that they have and will have the right to decide their journey. We wanted to empower that, we wanted to make that possible. We did all kinds of trainings, community engagement sessions, sensitization. We did outreach sessions. 3 exclusive peer groups was developed in the OneImpact, where people affected by DRTB can actually reach out and ask questions, and we have kept those peer support sessions really live. And the QR of our platform and the WhatsApp robo chat is literally on the patient cards, on the vehicles of the TB program that are running across the country, so that everyone affected by TB, or even a person from a general population, if they want information, they can access and they can anonymously have access to all the right information at one place. In terms of impact, we saw data-driven change. Over 25,000 people have been reached through survivor-led awareness and CLM platforms. Real-time feedback from the communities is now guiding the program. CLM, the community-led monitoring data, integrated into the national stigma study, into the community rights and gender assessment, shaping policy dialogues, and the results of the CRG assessment were eventually guided the national strategic and provincial strategic plan development, and eventually the Global Fund round 8 request. And this time, when we're starting our JPRM, we are planning to do the same. Evidence from the community-led monitoring informed DRTB patient advocacy and BPL-M uptake in the national plans. Empowered communities and survivors. Communities can now track the availability of gene expert and treatment sites through GIS-enabled dashboard, and through, in terms of policy scale-up, and to ensure that this efforts don't end here. Thanks to the support from United and Stop TB Partnership, we now have a global regional consortia called Respect TB. So all these efforts and all the work that has been done post Fast Track to Cure, it will continue. It won't end here. A future where technology learns from people and people lead with technology, and making this possible for the communities is a mission that we are driven by. I thank you very much.
Thank you, Kins. Kins' presentations and words are always powerful. I've seen her in this conference, in the last conferences, and it's always very remarkable. And I think Kins always begin with the right questions, the important questions. If you want to build people-centered, rights-based TB response, how can we achieve it without looking to the pathway of people affected, the experiences from communities? And I think her presentation highlights how community-led monitoring and those technology-driven initiatives can be a game changer in that. I think with that, we can move to the next speaker.
Thank you so much. So next speaker is Nurlianti from Indonesia and Stop TB Partnership. Nurlianti is a program manager at Yayasan Stop TB Partnership Indonesia with over 6 years of experience in tuberculosis work. Her expertise covers advocacy at national and subnational policy level, building multi-sectoral partnerships to support TB elimination efforts for the country, and mobilizing and strengthening community support as well. Welcome, Nulin, and we're really looking forward to your presentation.
Well, what's my question? Can you see me clearly? This is my common problem every year. But I hope you can hear me clearly. Yeah, first of all, thank you so much for attending this session, and as well as for the committee who are inviting me to join this session. Well, the chair just already introduced me. My name is Nurlianti, representing the Stop TB Partnership Indonesia. And for this session, we are going to kind of explain some of designing scalable, sustainable, and also adaptable digital tools for TB-affected community. But first of all, I have no conflict of interest to declare. So maybe I will begin with some kind of background on why we need kind of digital tools in Indonesia. So basically, because we are from Indonesia, you know that Indonesia is one of the highest TB burden. But we're having some kind of challenge to kind of reach people quickly, because some other things, especially because of Thousand Island and also remote access and in Indonesia. We also face kind of low awareness and also stigma, also cause delays in diagnosis, and the quality of TB service may be different from one region to other region. Community and the civil society need reliable real-time data to advocate effectively and ensure accountability as well. With Indonesia high mobile phone and internet use, you can see like everyone in Indonesia holding their phone everywhere, and the internet use everywhere in Indonesia. So the digital tools become practical and scalable solution. Digital platform can standardize reporting and then provide faster and more accurate data as well, and of course reach the community that the manual system cannot do as well. By moving to the digital tools, we do believe that we can improve the feedback and speed up the decision making and strengthen the TB response nationwide. Yeah, the digital tools also offer a strong opportunity to address all kind of challenge that I already mentioned in Indonesia. They can expand the reach, simplify the reporting, and amplify the voice of the community, helping people access timely information and then monitor the service quality and as well as participate more actively in the decision making. So in this presentation, I would like to kind of explain you some of the digital tools that we already have in Indonesia that we targeting to the TB affected community to amplify their voice and then to involve more in the decision making things. So these are the things, the digital tools that I'm going to mention. One of the things is the TB warrior screening. This is a kind of screening tools that we combine with the gamification. And the second thing is maybe similar with the previous speaker just mentioned about the community-led monitoring, because I do believe that every country already have it, but maybe in the different kind of implementation. And last thing, we have the TB policy tracker. Maybe I will explain you next about the details of the policy tracker itself. The first thing is about the TB warrior screening. This is kind of things that we having interactive mobile game that encourage early TB symptom screening, particularly for among youth. By blending education with entertainment, it turns screening into fun and engaging activities. So user can complete the mission, they come visit to the platform, and then they have a mission to complete it and learn about the TB facts and access their symptom in a simple and very accessible way. Adaptable to this local language as well and the culture context, if you can see in the slide. So we having a collaboration with 4 big university in Indonesia. We introduced this kind of screening tools to the students and asking them to access it directly. And we can found that more than 1,000 students access this kind of screening form. And among those who access the screening tools, more than 200 of them identify as people with the TB symptoms, and we refer them for the following up. So overall, the TB warrior screening show how gamification can reach youth where they already are, of course, on their phone, while strengthening awareness, screening, and early detection. And the next is the community-led monitoring. Basically, it's simply the same like what the previous speaker just mentioned. But in Indonesia, we do acknowledge this kind of application that it can give the TB affected community a direct way to report. So what we highlight here that everyone can report what is their feedback about the TB services. So if they report about the quality of the service that they receive, the community member and the TB survivor can share real-time feedback on the medicine availability, side effect that they are experienced, diagnostic service, treatment quality, or even stigma. So if we are talking about the BPAL and the BPAL-M, if someone are using the BPAL and BPAL-M and then they have the side effect, they can directly report the side effect here. And then they can directly get help from the community that we already train. What can they do to help those kind of people to address the side effect that they encounter? Or even if someone with the BPAL and BPAL-M experience stigma, they can report to this kind of the CLM, and we have our paralegal on the ground who are going to help in terms of the legal issues to address in the ground. So in its core, our CLM strengthen feedback, engagement, and voice of the TB-affected community. When the community can share their experience and when that feedback inform action, we move toward a more accountable, responsive, and people-centered TB program. And our next digital platform is the policy tracker for TB in Indonesia. So basically, this is a digital platform that brings all policies across Indonesia in national and also district level into one place. So if you would like to see what kind of policy that are there in Indonesia, you can just visit this kind of platform. You can see which district already have the sub-district regulation or any kind of budgeting allocation that is available in district. We put all things in one place, so we can track it directly from this platform. It's also used directly by the national government to track the subnational level achievement related to the policy itself. So overall, the policy tracker strengthen the transparency, coordination, and action in TB policy implementation. All of these kind of digital tools that we are mentioned, it's scalable, of course, because it can expand across the region. It can sustain because we have a very low cost of operation. Even in this current situation of funding, we can still continue those kind of digital platform because it's very low cost of the maintenance. And then adaptability, we can tailor it to the local language, workflows, and the technology readiness, and also the community center. Because before developing all kind of digital tools, we have any consultation with our TB survivor or frontliner from the healthcare workers, so they can provide like what kind of things that they need, and we already integrate in this kind of digital tools. And lastly, for me, to close my presentation, I just would like to emphasize that our 3 digital tools that currently used in Indonesia already provide real-time insight and support stronger advocacy, because together they build a more connected data-driven TB ecosystem. Ultimately, this digital innovation moves us toward a TB response that is more responsive, inclusive, and community-centered. I think that's all for me. Thank you so much for your attention. Looking forward for the discussion.
Thank you so much, Nurlen, an excellent presentation. And I think in my previous roles, I've seen how closely the TB Warrior and the gamification has worked. I think we can all agree one thing that we all struggle with the younger generation is also attention. They have so many things competing for their attention. So really creating innovative tools that tap into that attention and fixate them on something that is more productive in nature is fantastic. And I've seen how that's played a brilliant role in the TB Warrior work that Stop TB Partnership Indonesia has done. And I think it's a very important note that Nurlen ended her presentation on is how we need to ensure sustainability and also make sure that these digital tools are more context specific. And I think some key fundamentals that have to be available for digital innovation to work is internet access or access to smartphones. And that's where really, then innovation can actually start if you have some of these basic things available. But we would love to, sort of deep dive into this during the Q&A to see what do we do in areas and populations who maybe don't have access to this. But that's for a Q&A. I will request my co-chair to kindly introduce the next speaker.
Okay, our next speaker is Dr. Stephen Nguva from Kenya. Stephen is the national coordinator of the Kenyan TB Champions Network and also the executive director of the Pamoja Group. And he was inspired to create Pamoja TB Group after his own experience during his TB treatment. And Pamoja TB Group implemented Impact for TB advocacy project supported by TAG for 3 consecutive grants. Very impressive, Stephen. Please, the floor is yours.
Thank you very much. Good morning. Good morning. Good morning. I know it's cold, but we can make it more warmer. Good morning.
Good morning.
Everybody show me your gadget, either phone, laptop.
Here.
Yes. So we are talking about digital, and we need to ensure that our people are able to access information and support when they get TB so that they are able to adhere to their treatment. So I'll be sharing briefly about how we can use digital space to ensure that we are addressing TB issues and how we can engage young people. As my fellow speakers have said, young people have different way of doing things and different way of accessing information. And this is a digital space where somebody just types and they get information. And it is upon us that are called senior citizens or aging generation to ensure that we are putting the correct information to them. Because if people Google and don't get the right information, then they will end up doing it wrongly. So I have no conflict of interest. So as we all know, TB is a major public health threat, and it is continuing to claim a lot of people every year. Around 10 million new cases are reported, and we all saw that through the WHO Global TB report. And the disease hits hard among the vulnerable population and people living with HIV, those who are struggling also with poverty. So from myself, TB made me understand my ability to and the importance of standing with others. I think I was given this mountain to show others it can be moved. Yes, we can end TB together. So when we address about harnessing the power of digital platforms to combat TB and mainly DRTB, one, it's an avenue to expand awareness campaign. It's an avenue to ensure that we access up-to-date, accurate, and reliable information. Underline the word accurate, because there is information, but it needs to be accurate and reliable. To encourage community participation and establish support network of TB patients. We have different platforms and we have different networks, the likes of Unite Youth, where young people can come together, but they need reliable and accurate information. So we need to ensure that the information that is out there on digital space, it is accurate and reliable. So when we say putting patient at the center of digital solution, mainly is to develop digital platform that prioritize the needs of patient, not only doctors. The needs of patient, not only doctors, and also to provide personalized support and guidance to improve treatment outcomes. There are some people that no matter how the doctor tells them, if they don't see that on digital space, if they don't Google, they will definitely go wrong. There are some people after the doctor has spoken to them more than 2 hours, they also go and consult Google. And I know most of us do that, just to affirm. So if we don't have the correct information in digital platform, then we are going to end up having people getting the wrong treatment, wrong diagnosis, and adherence and treatment outcome will be very poor. Also, digital platform helps to strengthen patient engagement and promote self-management in TB care. It also helps to collect and utilize feedback to refine and optimize TB services. I think our colleagues from DOPASI highlighted on how they use different tools. Those tools are supposed to have a component of feedback, whereby as communities affected with TB, we are able to provide feedback on how services are provided, what services we need, and how we need services to be improved. So it's not only about information, but it's about conversation, whereby we as also affected communities, we are able to be given an opportunity through those digital platforms to also share on how we want services to be provided. So you can join us in raising awareness by reaching far. I know some of us have more than 100,000 followers in our Facebook, Instagram, Twitter. Post a message on TB today there. When you post an accurate message on TB, you will help somebody know that there is TB. Don't just post food. Don't just post pictures of traveling. You can post a message about importance of TB treatment, importance of adhering to treatment. And you don't know, you might be reaching people that would have never been reached by any other person, but your post on digital platform, on that social media, will help somebody. Utilize those digital platforms to amplify TB voices, and also call for accountability and action from our leaders. Some of us cannot talk to our leaders, political leaders direct, but when we post on social media, they read. Our presidents read Twitter, they read X, they read Instagram, they look at Telegram. Maybe the only way we can reach out to them is by using our digital platforms in social media, by telling them what we want them to do in fight against TB, including funding. So finally, together we can make a difference. Together we can harness the power of digital platform to raise TB awareness, inspire action, and move closer to ending TB. Thank you very much. Asante sana.
Thank you, Stephen. And you see, Aman ended his presentation by saying up from patients to leaders. And Stephen is a concrete example and gave us so many data to think about the role of technology, and in a world of fake news, of us discussing the ethical concerns of using, for example, AI, as you said, the digital battle and how it influences political and decision makers. I think your presentation gave us a lot to think about our collective accountability and our role in using technology in favor of the TB fight. So I think we can go directly to our Q&A. We would love to hear your comments and questions for our speakers. So please, if you have a question, please raise your hand. We have our support team here with the microphone. And please introduce yourself. We would love to know your name, your organization, your country when you make your question, please. Thank you.
Thank you very much.
I think it's all.
I'm Dr. Ghulam Nabi Kazi, Gabasi Foundation, and also with the union as editor-in-chief of PHA. I came a little late, so I'm not sure if I missed any presentation, but all the four were excellent. Starting with Dr. Shukla. Yes, you raised a very important point, sir, about nutrition's connection, undernutrition's connection with TB. To my mind, extreme poverty or hunger poverty and tuberculosis both are public health emergencies. And not since now, ever since I can remember. And we're not doing enough for both. What is more, they're all both a result of social injustice. Nature has given us enough food, enough medicines, enough vaccines, but the fault lies with our own selves that we don't distribute them evenly, as we even saw in the COVID vaccine. Then Ms. Kizun Iman raised a very important point that the visibility of urban health centers is very low. You see, in the rural areas, you may be knowing that 1 kilometer away there's a rural health center. But in the urban areas, it might be next to your house, but you won't know it. So our idea of having it on the Google Maps, along with the name of the facility, you can always put it on the Google Map. This is a TBMU and so on, or a PMDT site. Noriyanti, actually, we were bringing a TB warrior here, but both his mother and he didn't get the visa. Otherwise, you would have seen him here. Stephen, actually, the problem is TB is not hot and sexy. So take HIV/AIDS. I mean, TB is a much greater problem. But people feel more excited reading about HIV. I don't know why, but not so much with TB. Thanks.
Thank you. So let's take another comment. I think that the gentleman in there, and then the third one. Okay.
My name is Ernest from Ghana, representing the TB-affected community in Ghana. I don't know, Dr. Iman, I don't know whether I have the name right. I'd wanted to know the OneImpact that you use for the CLM assessment and stigma index. I want to know a little more. Is it the case that the quantitative and qualitative data were all on the app and then utilized for those assessments and then those study? I want to know a little more about that. Yeah, thank you very much.
So there are two ways. One is where we push active surveys. Active surveys, most of the time we try to keep the questions minimal to respond so that either we get a one-word response or we get a yes-no response or multiple scenarios so that analysis can be done under the key sort of barriers: accessibility, acceptability, availability of care, human rights issues, stigma, and that, so that everything can be pooled under certain thematic themes. So that is done. In terms of barrier that are raised, let's say, for example, if I'm going to a facility and because and the facility says, oh, I don't have medicines, come back tomorrow. Then I go to the facility again and it says, come back tomorrow. And the facility says that we are facing a shortage of medicines. Then we will get that, and we'll eventually talk to the district why you don't have medicine. If the district, let's say for example, says no, the medicine never came from NTP, we'll go to the NTP and ask. And most of the times what happens is the supply chain from NTP, provincial programs, everything is sometimes the medicines are at the district health facility. So it's not the problem of the national program or the provincial program, rather the distribution in the district that causes the problem. But through this, we exactly know. And then even the authenticity of a barrier coming, if a facility is over and over saying that doctor wasn't there, doctor wasn't there, doctor wasn't there, that means that there is a problem that is happening there. So there is both one where you can collect data in sending a survey and it goes to all the 20,000 users. It's on their discretion whether they want to take the survey or not. And then it is real time. If you go to a facility and you're denied of access, let's say, for example, a transgender went to a facility and somebody's making fun of him, he or she, the person can raise a barrier. And then the community champion will validate that barrier and link it to the particular place where the response is required.
Great. I think we have 2 more questions. Okay.
Thank you so much for the presentations. And I'm so glad that it's coming from the young people, and we really embrace that. My comment is on Salem. On Salem, it is a very powerful tool for communities and everyone in the communities, KVPs and so forth. But there's a hitch between what we do as civil society and communities and the Ministry of Health. Our role is to complement Ministry of Health's work. Salem is missing indicators to be part of the DHS too. And because of the aid cuts, and that most countries just rely on Global Fund. And I'm able to say yesterday, Global Fund announced the dates that we are starting GC8, 8 June going forward. If we cannot help each other from now to come up with an investment case for Salem with the indicators, some countries will find ourselves the Salem not appearing in the funding request. Salem is stronger when we meet back with communities. Salem is stronger when we feed back to communities, vice versa. But the first activity which was removed by Global Fund was no meetings, no travel. How are we going to feed back to that village, to that hard to reach? So my cry is, everyone, we are talking innovation. Can you come with an innovative Salem indicators so that we have an investment case to help every country which has got Global Fund? That is the only money we have. Without Global Fund, nothing. But I'm seeing our RSSH model on Saraj and so forth, on human rights and so forth. We are going to fall short if we are not going to start now. Kins, I challenge you, you can lead that process. Let's continue this discussion from here. I need help. I am a vice chairperson for system in Zimbabwe. I saw it when we were doing prioritization. I saw it that we might lose this very powerful tool that has made us to speak loud, our voices, but we might lose it if we don't get help from all our technical partners and everyone. I thank you.
Thank you.
Thank you. Good morning. This is Khaled from Narimoti, Bangladesh. So that was a very excellent presentation that we have shown in here. So my question is, actually, we have shown some digital tools in here. So how this tech solution can be reaching the most vulnerable people, like in the youth, women, migrants, and also in the prison? Actually, they are the most key vulnerable populations in there. So my question is not how we can reach to them, not just the digitally connected groups in people in here. So what could be the solution in here? That's my question to you. Anyone can ask us. Thank you.
Challenging question. How could you?
Thank you very much. That is a very dynamic question because all of us are putting on shoes, or nobody is putting on shoes, but different sizes. So it's very hard to be prescriptive when it comes to digital tool. However, we say whatever is available and whatever we are currently having access to, let us use them to ensure that we are pushing the TB information. That your Facebook, that your X handle, that your YouTube, that your Instagram, that is the platform. Don't look for platforms out there. Use whatever you have to ensure you are putting out there the correct and accurate information on TB. That's my way of thinking.
Anyone else? Yes, please.
Yeah, thank you so much for your question. So basically, there's a lot of key vulnerable population kind of things. But when we design in kind of digital tools, first of all, what we are going to see is who are our targeted population, of course. So like what is the previous speaker just mentioned, we cannot prescribe like one single digital tools that is solely will be used by one kind of population. So in terms of designing the digital tools, we have to be sensitive. Who are our targeted population? So if we are designing kind of the TB screening tools that I presenting previously, because we are targeting the youth, so every single educational things we put in it targeting the youth. But back then, if we are moving forward to other TB key vulnerable populations, such as the prisoners or any other TB key vulnerable population, we need to look for what kind of digital tools that is available there for them. So we can't force them to having like a dedicated platform that they can directly access. So it will be adjustable based on what kind of modality that they can access and what kind of things that is in their daily basis they refer to seeking information or any kind of things to looking for the healthcare services access in hand. Thank you.
So thank you. We are approaching, unfortunately, the end of this session. I thank all the speakers for the excellent presentations. And I have one final brief question for all of you. If you could share a piece of advice for NTP, for National TB Program Managers, about working with youth or digital innovation, what would it be?
I think I'll start just an information to NTPs is that youth are not threat. Engage them. They are available and they are resourceful. So engage youths. Don't fear youths. They are not a threat.
Yeah, good.
Yeah.
Okay, please go ahead.
Yeah, maybe just a simple thing for me. Youth is a new hope. It's a strong power, so let's working together.
Most of the time I see NTPs are very much want to get into treatment or into technical aspects. I encourage them to talk about storytelling, journey, and talk about the resilient rights that TB communities has gained. Also treat TB as not just as a health goal, but as a justice goal.
I'm super lucky and blessed that my NTP manager in his last tenure actually asked me to log in the OneImpact dashboard in his in his computer. He knows about the OneImpact way more than any other NTP manager, and he was the first one who included the JPRM, the CRG data into the JPRM. And this year he has again added not only communities but also even climate vulnerabilities that communities are affected by. So I'm super blessed. I don't have any suggestion. Thank you.
Yeah, one thing I remember, I think you participated online 2 years back in Manila. And there was a meeting on this by the Stop TB, how to empower, our colleague talked about transgender who is going to a healthcare facility. On the basis of that, if the treatment is denied or there are some discrimination or like this. So the OneImpact, the community empowerment, the patient empowerment, consumer empowerment, that is very important.
Absolutely. Yes. Thank you so much for your contribution. Thank you again, the audience, for your engagement and also contributions. Thank you, Akshaya, for sharing this with us. Thank you, speakers. And as we close this session, I also, as a NTP member, I would like to highlight how important it is for national TB programs, for every decision and policymakers to truly incorporate the evidence, the data generated by youth and by civil society. And throughout the other sessions that I had the opportunity to attend from Community Connect sessions, the message is clear and consistent. Civil society needs to be treated as equal in also shaping the interventions, and as the lady from Zimbabwe also stated, the funding, the feasibility of a community system and the participation, the social participation is also very important for us to discuss. So thank you so much again. I think this was a very important session, and have a good day, everyone. Thank you so much.